Hello, everybody, and welcome back to our latest VernaTalks. I'm delighted to be joined today by Carole Hallam, independent nurse consultant in infection prevention. Hi, Carole. Good to see you again.
Hi, Clive. Thank you for having me back.
It's our pleasure. I'm seeing a lot on the news about test and trace. Now, I've actually worked in infection prevention for a long time myself, but I'm very confused as to what test and trace is and what it involves. Could you explain a bit to us about that, please, Carole?
Thank you for asking me, Clive. Yes, the test and trace is really important in our as we move forward with our control of COVID-19. I mean, we've been on lockdown. As we release that lockdown, this is a really important way forward. So basically, the test and trace is being able to identify people that are carrying the virus and those that might have been in contact and therefore might be incubating the infection. So the key to this is people being very aware of what the symptoms are. We've heard a lot about the symptoms since the beginning of COVID, but just as a reminder, and it's really, really important, this is it's anybody that develops a new temperature, a high temperature. So we don't need a thermometer here. We just need to know that the skin is feeling particularly hot. I would suggest that you feel the back of your neck or your chest rather than the forehead, because if you've been sat in the sun, although we haven't got sun today, your forehead could get hot quite quickly. So if you feel the back of your neck or your chest, so a high temperature, or if you have a new continuous cough, so that is coughing a lot for more than an hour. Now, some people have a chronic cough, if particularly people are smokers. So those people generally will see a worsening of a cough. And then we got this third sort of key symptom, which is the change in taste or smell, or the absence of smell and taste. And that was new. So what I would say here is the majority of people the first symptom they have will be the high temperature. I think they say 88% of people have a high temperature first. 68% will present with a cough as their first symptom. So obviously you've got some people with a cough and a temperature, but only a lot fewer people will have that change in taste and smell as their presenting symptom, although it might be present with the cough and with the temperature. There's other symptoms as well, things like uh, aching muscles, joints, fatigue, sore throat, headache. Those are often associated with the temperature, but all can be associated with COVID. So the message is, if people have any of those symptoms of a high temperature, new cough, change in taste and smell, then actually they need to self-isolate. The first thing you need to do is self-isolate and then order a test. So it's very easy to order the COVID-19 test. This is looking for the infection. So simply go on the NHS website, click on the coronavirus, and it'll take you through, and you can choose whether you have your test through a drive-in centre or whether you have a test kit sent out to you. So as well as you isolating, you also need to have all your family or your household contacts. They need to isolate as well for 14 days. So the reason that you isolate with the symptoms for 7 days is that's the period of infectivity. So that's the period that you're thought to be infectious for. Whereas your household contacts have to isolate for 14 days, and that's the period of incubation. So the incubation period is when you're exposed to a disease to then getting the symptoms. So it's just slightly different. So that's the 7 days and the 14 days. Um, if you test positive, then you will be get contacted, and they would ask you who have you been in contact with, who have you uh, where the places you've been to, sorry, and names of any contacts the last 48 hours in your household contacts. So people might say, oh gosh, I walked down the street, I really can't remember who I passed in the street. And what I would say there is, actually, most of the time you're socially distanced when you're out and about, but actually the virus needs to pass by droplets, and to pass on the droplets by passing somebody casually in the street, that's very, very unlikely to happen. So just a reminder, to pass on the infection, you have to inhale the droplets of the coronavirus, the COVID-19, into your nose and mouth to get the infection, or you have to contaminated hands, you get the virus on your hands, and you put those to your eyes, nose, or mouth. And the reason that the test and trace is so important is being able to identify people, trying to prevent that further spread, which then is very much about that R number that we talk about with the politicians and the media, and that's the R equals the reproduction of any disease, its ability to spread. We need to keep that as low as possible and definitely below 1. Does that help you, Clive?
Thank you so much. Yeah, that actually does. That makes it a lot clearer. So hopefully it won't actually happen, but let's say that I'm actually contacted, that I am a contact, or in a worst case scenario, I'm actually diagnosed as positive for COVID-19. What should I do?
Okay, so if you are contacted to say you're positive, or if you're contacted to say you're a contact, first thing I would say is don't panic about either. And I think it's really important to say is there's only one number that they'll contact you on. So it's really important that when people order a test and give that information, they take a note of that number. So that just stops people that scam you and send you false information and tell you have to pay for further tests, etc. So the NHS will not ask you to do that. They'll give you one number. So if you're contacted, say you're positive, then what I would say is the majority of people do not have nothing more than minor symptoms. The majority of people have minor symptoms. So you stay at home, you stay isolated for 7 days, your household contacts for 14 days. If at all possible, it is sensible if you can try and isolate yourself away from some of your family or your household contacts. So if you've got a spare bedroom, that will be really good. If you've got if you can distance yourself in say like the kitchen, or you go in the kitchen after other people have been in. But if you're in fact have only got a small house or flat and you can't distance yourself, you can't separate, maybe face coverings would help. But I think the most important thing here is about good hand hygiene. So making sure hands stay clean. The respiratory hygiene, which is if you cough or sneeze, is to make sure you cover your mouth with a tissue. Dispose the tissue straight away. Wash your hands. You can either wash your hands with soap and water, or you can use alcohol hand rubs, very effective against the coronavirus. So do you remember we had a flu campaign a few years ago with the catch it, bin it, kill it? That's your respiratory hygiene. That very much you catch the virus, or you catch the bugs into your tissue. You then dispose those tissues. So you bin it, you kill it by washing your hands. And then the other thing that's really important in the home setting is to keep your surfaces really clean. And you don't need any fancy household cleaners. This is a virus that actually on surfaces is killed off very, very easily with most household cleaners. So you don't need to go out and buy anything fancy. We want you to stay at home and just your general household cleaners. If you feel unwell, if you start to feel really unwell and you feel you need to see a doctor, please don't go to the GP. If you ring 111, either go online or phone 111, they will advise you. So they'll ask you some questions and then they will send you to the appropriate person to make sure those people know that you're to expect you and have the right precautions in place. So I think that's really important. So the second part of your question was, if you get contacted because you've been a contact. Okay, so if you've been contacted that you're a contact, then you actually need to isolate them for 14 days. So again, it's that incubation period, 14 days. The rest of your household do not need to isolate unless they are symptomatic or you are symptomatic. So if you've got no symptoms, you isolate, but the rest of your household don't need to isolate. And again, it's back to those precautions about if you can segregate yourself from those family members, those household contacts, and those good measures of hand hygiene, respiratory hygiene, and keeping the surfaces clean. Okay.
Thank you so much. Yeah, catch it, bin it, kill it. That was a fantastic campaign. That possibly the NHS, we need to revisit that. That's really good. Thank you so much, Carole. Really appreciate your time again today.
Thank you, Clive.
If anyone's got any questions for Carole or for us at VernaCare, please don't hesitate. Put them in the comments and we'll get back to you. But thanks again, everyone. Stay safe.